Introduction. Febuxostat is a medication used for the long-term treatment of gout caused by high uric acid levels in the blood. It is generally recommended for individuals who cannot tolerate allopurinol. Febuxostat is taken by mouth. The drug was approved for medical use in the European Union in 2008 and in the United States in 2009. A generic version became available in 2019. It is marketed under various brand names such as Uric, Europe, Australia, New Zealand, and Pakistan, Uric, United States, Feburic, Japan, Donafoxate, Egypt. Other names in Latin America and generics worldwide. Mechanism of action. Febuxostat is a non-purine selective inhibitor of xanthine oxidase. Xanthine oxidase is an enzyme required to convert hypoxanthine into xanthine and then into uric acid. Febuxostat inhibits both the oxidized and reduced forms of xanthine oxidase. By tightly binding to the molybdenum pterin site of the enzyme, it reduces the production of uric acid in the body. After oral intake, absorption. At least 84% of the drug is absorbed in the gut. Peak concentrations. Maximum concentrations in blood plasma are reached within 60 to 90 minutes. Effective food. Fatty meals slightly lower the drug's concentration, but this is not clinically relevant. In the bloodstream, 99.2% of the drug binds to albumin. 82 to 91% of active metabolites bind to plasma proteins. Metabolism. Febuxostat is metabolized into 3 active compounds, 67M1, 67M2, and 67M4. Metabolism occurs primarily through liver enzymes such as CYP1A1, CYP1A2, CYP2C8, and CYP2C9. These metabolites are further processed by glucuronidation enzymes, including UGT1A1, UGT1A8, and UGT1A9. Elimination. The drug is excreted via urine, 49%, and feces, 45%. Urine, 3% unchanged febuxostat, 30% as glucuronides, and 13% as metabolites. Feces, 12% unchanged febuxostat, 25% as metabolites. The elimination half-life is 5 to 8 hours. Side effects. Common side effects: nausea, diarrhea, joint pain, rash, headache, increased liver enzyme levels. Serious side effects: increased risk of heart-related death compared to allopurinol. Stevens-Johnson syndrome, anaphylaxis, heart attacks, strokes, or inadequate blood supply to the heart, from studies conducted on over 6,000 patients with cardiovascular histories. In November 2017, the United States Food and Drug Administration issued a warning about an increased risk of death from heart-related issues and all causes when compared with allopurinol. Contraindications. Febuxostat should not be taken alongside theophylline azathioprine, 6-mercaptopurine. These combinations may lead to increased toxicity due to higher plasma concentrations. Use as monotherapy or in combination monotherapy. Febuxostat is commonly used alone for the treatment of chronic hyperuricemia associated with gout. It is suitable for individuals who cannot tolerate or have contraindications to allopurinol. Combination therapy. Febuxostat can be combined with other drugs for improved efficacy, particularly in patients with refractory or severe gout. Suitable combinations include colchicine for managing acute gout flares, while febuxostat controls uric acid levels. Nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce inflammation during acute episodes. Probenecid, for patients with underexcretion of uric acid to enhance uric acid elimination. Allopurinol. In rare cases, it may be combined for patients requiring more aggressive uric acid reduction. Losartan, for patients with hypertension and hyperuricemia. Most popular international brands containing febuxostat and manufacturer details. Uric, manufacturer, Menarini country, Italy. Uric, manufacturer, Takeda, pharmaceuticals, country, Japan. Feburic, manufacturer, Teijin country, Japan. Donafoxate, manufacturer, Amon Pharmaceuticals, country, Egypt. Gouty, manufacturer, Romer's country, Argentina. Adverse events. Common. Adverse events: nausea, diarrhea, headache, joint pain, rash, increased liver enzyme levels. Serious adverse events: cardiovascular risks, including heart attack, stroke, and increased mortality compared to allopurinol. Severe allergic reactions, including Stevens-Johnson syndrome and anaphylaxis impact of food, when taken with a fatty meal. Febuxostat reaches lower blood concentrations, but this is not clinically significant. When taken on an empty stomach, absorption is not significantly impacted. It can be taken with or without food. Specific foods. No food interactions have been specifically identified, but a healthy diet is recommended for better gout management. Drug interactions: azathioprine and mercaptopurine. Febuxostat inhibits xanthine oxidase, leading to increased levels of azathioprine or mercaptopurine, which can cause severe toxicity. The combination is contraindicated. Theophylline. Co-administration may increase theophylline levels due to reduced metabolism, necessitating caution. Cytotoxic drugs. Febuxostat increases the risk of toxicity when combined with drugs metabolized by xanthine oxidase, such as cyclophosphamide. Allopurinol. Simultaneous use may not be recommended unless under strict supervision due to overlapping mechanisms and increased side effects. NSAIDs. Safe when co-administered for acute gout attacks. No significant interaction observed. Warfarin. Febuxostat may slightly alter warfarin's anticoagulant effect. Close monitoring of INR is advised. Food interactions. Fatty meals. Reduces the peak plasma concentration of febuxostat, but does not affect the overall therapeutic effect. Can be taken with or without food. Alcohol. Alcohol consumption increases uric acid levels and can worsen gout symptoms, so moderation is recommended. High purine foods. Foods rich in purines, for example, organ meats, red meat, and certain seafood, may counteract febuxostat's efficacy. Avoidance is advised for optimal treatment outcomes. Dairy products. No adverse interaction. Dairy can be included in a gout-friendly diet. Pharmacology classification. Febuxostat is a non-purine selective inhibitor of xanthine oxidase, primarily used for managing hyperuricemia in patients with gout. Mechanism of action. Febuxostat blocks xanthine oxidase, preventing the conversion of hypoxanthine to xanthine and xanthine to uric acid. Reduces uric acid levels in the blood. Pharmacodynamics. Onset of action. Febuxostat significantly lowers serum uric acid levels within 2 to 3 hours of oral administration. Target effects. Maintains serum uric acid below 6 mg per deciliter in most patients. Selectivity. Highly selective for xanthine oxidase without affecting other enzymes in purine and pyrimidine metabolism. Effect on uric acid crystals. Long-term use can dissolve uric acid deposits in joints, reducing gout symptoms and flares. Pharmacokinetics. Absorption. At least 84% of febuxostat is absorbed after oral administration. Peak plasma concentration occurs within 60 to 90 minutes. Distribution. 99.2% of the drug binds to plasma proteins, mainly albumin. Metabolism. Metabolized primarily in the liver by cytochrome P450 enzymes, CYP1A1, 1A2, 2C8, 2C9. Produces 3 active metabolites, dicarboxylic acid and 2 hydroxylated derivatives. Further glucuronidation occurs via UGT1A1, UGT1A8, and UGT1A9 enzymes. Elimination. Excreted in urine, 49%, and feces, 45%. Urine, 3% unchanged drug, 30% glucuronide, 13% active metabolites and their glucuronides, and 3% unknown entities. Feces, 12% unchanged drug, 1% glucuronide, 25% active metabolites and their glucuronides, and 7% unknown entities. Half-life. The elimination half-life is 5 to 8 hours. Maximum daily dose. Recommended maximum dose. Febuxostat, 40 mg once daily for mild to moderate hyperuricemia. For severe cases, up to 80 mg once daily. Dose adjustment may be required based on patient response and kidney function. Chemistry. Chemical formula. Febuxostat, C16, H16, N203, S. Molar mass, 316.3 grams per mole. Half-life, 5 to 8 hours. Melting point, 204 to 205 degrees Celsius. Solubility, sparingly soluble in water. Soluble in organic solvents like dimethyl sulfoxide and ethanol. Organic molecule class. Febuxostat belongs to the thiazole class of organic molecules. Bioavailability, approximately 84% after oral administration. References. Clinical pharmacology of Febuxostat, country United States, year 2010. Findings: highlighted Febuxostat's superior uric acid lowering efficacy compared to allopurinol in patients with gout. Gout and Hyperuricemia Management by Arthritis Foundation, country United Kingdom, year 2012. Findings: emphasized Febuxostat's role in patients intolerant to allopurinol due to adverse reactions. Febuxostat, a new approach to gout treatment in International Journal of Rheumatology, country Canada, year 2018. Findings: studied long-term safety and efficacy, confirming Febuxostat's benefits for chronic gout management. Hyperuricemia control with Febuxostat by National Center for Biotechnology Information, country United States, year 2020. Findings: demonstrated its advantages in patients with kidney impairment due to non-purine-based mechanisms. Pharmacokinetics of Febuxostat in Journal of Clinical Pharmacology, country Japan, year 2016. Findings: detailed Febuxostat's metabolism, absorption, and high protein binding properties for effective treatment.